Good morning, class. Today we will start with new
Trial version.
chapter of our industrial pharmacy. One subject that is parental products. In the parental products, in the chapter,
Trial
we will
version.
go through the introduction, advantages, disadvantages, or limitations of parental products, then types of parental products based upon its use, based upon
Trial
volume,
version.
based upon route of administration, and based upon packaging time. Then pre-formulation studies of your parental products, then essential requirement of parental products,
Trial
then
version.
vehicles and additives which are used for the formulation of parental product, then importance of isotonicity which we have already seen,
Trial
then production
version.
procedure of parenteral, what are the steps which are involved in the production or preparation or formulation of parental product, then production facilities and their control, what are the different production facilities which are
Trial
required for
version.
the formulation of parental product and how to control these production facilities. Then production formulation of different
Trial
parenteral
version.
products like injection, sterile powders, emulsions, suspensions, large volume parenterals, and lyophilized products. The next point we have to see
Trial version.
containers and closures, which are being used in the formulation of parental product. Sorry, in the packaging of parental products. The next point is filling.
Trial
How
version.
filling of parental product is carried out inside the containers. Then sealing, and last is quality control test for parental. So which are the tests, IPQC as well as finished product test
Trial version.
carried out for the evaluation of parental product. So we will start with first introduction. So look, the word parenteral,
Trial version.
it is basically combination of two words. First one is para and second is interal. So parental word is derived from the word para, enteron, meaning other than the
Trial
intestine
version.
administration. Para, the word meaning of the word para is apart from or other than. Enteron means intestine. So generally,
Trial version.
when any drug is administered in the tablet form or capsule form, that drug first goes inside the intestine, and after going to the intestine, it gets
Trial
absorbed
version.
and show therapeutic effect. But in case of parental product, that product does not go or come in contact with intestine. Then how that product goes into
Trial version.
your body? So that product is directly administered into the systemic circulation. Generally, that product is directly administered into systemic circulation without coming into
Trial
contact with
version.
your intestine. Hence, these products are called as a parenteral products. Parenteral route can be defined as the introduction of medicament nutrition into the body other than the alimentary canal, that
Trial
is
version.
your intestinal canal. As the natural defenses of body are bypassed, taking medications by parenteral route poses a greater risk than other routes like oral and
Trial version.
rectal route. So when you administer any drug through the parenteral route, the mechanism which are involved for the production of body are bypassed.
Trial
Hence,
version.
one should take a great care in the formulation as well as administration of parental products. Parental preparation must be exceptionally pure and free from
Trial
physical, chemical, and
version.
biological contaminations, as these are directly injected into body. So any kind of contamination is not allowed for the in the parental
Trial
product
version.
while formulating, while handling, or while injecting also. So any kind of contamination is not allowed, as these parental products
Trial
directly
version.
come in contact with your body, directly come in contact with your systemic circulation. Drugs are
Trial
administered
version.
parentally for a number of different reasons. So one might think, why drugs are administered through parenteral route? If you can give that drugs through oral route or any other topical route
Trial
or rectal
version.
route, why parenteral route is preferred? So there are n number of advantages for the formulation of drugs through parenteral route. One of the reasons for administration
Trial
of drug through
version.
parenteral route is that the drug is administered by the intravenous route. Then there is an immediate onset of pharmacological action, unlike tablets, which take approximately 30 to
Trial
45
version.
minutes to have an effect once taken. So all of you know that what means onset of action. So onset of action can be defined as the time required to show the action,
Trial version.
the time required to show the action of any dosage form. So generally tablet, capsule, or the medicaments which are taken orally
Trial version.
take a time to show their action. Like tablet may take up to 15 to 30 minutes to show the action. Liquid formulations may take some less time than
Trial
tablet,
version.
but obviously these are going to take a time to show their action. But why these will take a time to show the action? So n number of processes must
Trial
happen
version.
to show the action. Like when tablet is taken through the oral route, tablet must undergo disintegration, dissolution, absorption, first pass metabolism, and then drug will enter into the systemic circulation to
Trial
show its
version.
systemic effect. But if the parental product or parenterals or intravenous product are given directly into the systemic circulation, these all
Trial
steps
version.
are bypassed or avoided. So direct drug comes in contact with the systemic circulation and maximum bioavailability is shown within a short period
Trial
of time
version.
or instantly. So one of the main advantage of parental product is that immediate onset of pharmacological
Trial version.
action. So as I told, another advantage of this route is 100% bioavailability of drugs as compared to tablet or other dosage form.
Trial
Drug
version.
targeting to the particular body is also important. So, by using various techniques while formulating parental dosage form,
Trial
the
version.
drugs can be targeted to the particular site. Drugs can be targeted to the particular site. So, if there is a cancerous cells in the
Trial
body,
version.
by using particular mechanism or particular formulation techniques, that particular drug can be targeted only to the uh, uh,
Trial
cells
version.
of the body which are cancerous. Okay, so targeting is one of the main advantage of parental product. Then this technique also allows for some of the more toxic drugs to be
Trial
targeted
version.
to the specific site without affecting other parts of body. So, as I've said, cancer uh, can be treated by using
Trial
this
version.
active targeting of the cancerous cells. Like many cancerous anti-cancer drugs are having toxicity, so that might affect the other
Trial version.
normal cells of our body. So if we do active targeting of these drugs inside the cell, inside the cancerous cell, then normal cells will not get hampered
Trial
or no
version.
toxicity will occur to the normal cell. This is one of the advantages. Those drugs which are after oral administration get destroyed can be administered by parental route. For example, insulin. So all you know that
Trial
insulin is used
version.
for the treatment of diabetes. So insulin cannot be taken by oral route as insulin is a proteinous in nature
Trial version.
and it can be degraded by the acid which is present in our stomach. So what to do in such case? So in such case, insulin can be directly administered into the systemic
Trial
circulation.
version.
So the destruction of insulin by the gastric juices will be avoided, and maximum amount of drug or insulin will be present inside the body. So
Trial
what can be the
version.
definition of parental products? So parental products can be defined as the sterile formulations intended for administration under or through one or more layers of the skin or mucous
Trial version.
membrane. So parental formulations can be defined as a sterile formulation. So the word sterile is important. So all you know what is the meaning of word sterile? Sterile, the
Trial
simple meaning of
version.
the word sterile is free from any kind of viable microorganisms. Any kind of viable microorganism should not be present inside the parental product. Then
Trial
such
version.
products can be called as a sterile product. And intended for administration under or through one or more layer of skin or mucous membrane. And
Trial
these
version.
sterile formulations are used or are used or administered inside the body or inside the systemic circulation
Trial version.
through the layers of skin or mucosa membrane. So we have to see various advantages which are related to parental product. So one of the main
Trial
advantage of
version.
parental product that in case of emergency clinical conditions such as cardiac arrest, shock, etc., an immediate physiological response can be achieved through the parental route.
Trial version.
So by using parental route, quick response of any drug can be obtained and which is useful for very serious conditions or
Trial version.
emergency conditions such as heart attack. So if patient is suffering from a heart attack, at that time you have to inject drug directly into the systemic
Trial version.
circulation and not through the oral route. If you are giving drug through oral route, then there might be chances that patient may not survive
Trial version.
because that drug will take a time to show its effect. So if anybody want a quick effect for the quick relief or quick treatment of cardiac arrest or shock,
Trial version.
then drugs are administered through parenteral route only. Then second advantage, as we have discussed, that drugs which are get destroyed by the
Trial
gastric
version.
juices can be delivered by the parenteral route. Third advantage, so drugs can be administered or injectables or parenterals can be administered
Trial
into the
version.
patients which are unconscious or uncooperative or nauseous. Now generally what happens when you give tablet
Trial version.
dosage form, so patient which are unconscious or which are having a nausea can immediately can, in such
Trial
cases
version.
that tablet will not show its effect. Basically unconscious patient cannot engulf the tablet, and a nauseous patient is, if there is nauseous patient, it will engulf a tablet, he or
Trial
she will
version.
engulf a tablet, but ultimately if he or she omits the drug, the tablet will come out of its stomach. So by using parenteral
Trial
route,
version.
you can give drugs to the uncooperative, nauseous or unconscious patients. In case of, in some
Trial
cases, local
version.
effect of drugs is required. Like in case of dentistry or anesthesiology, they can be achieved by parenteral route. Dentistry, so the
Trial
science which is
version.
related to your teeth, we call it as a dentist. That doctor is called as a dentist. So sometimes you might have, if
Trial version.
you have any appointment with a dentist for the removal of teeth or any surgical procedures, the dentist may
Trial
administer
version.
a local anesthetic to the that particular area so that pain will not occur. So for obtaining that
Trial
local
version.
anesthesia for that local or particular area, drug can be directly injected into that area. Then next, parental dosage forms can be formulated along
Trial version.
formulated long-acting depot preparations like long-acting penicillins administered through intramuscular route. So parental products can be formulated as a long-acting formulations.
Trial
So once the
version.
parental productions are deposited inside the skin, they will show their effect for 1 day, 1 month, or up to 1 year also. So that much of long effect can be
Trial version.
obtained by using parental preparation. So this is the one of the advantage. Then next advantage is that
Trial
parental therapy
version.
provides means for correcting serious disturbance of fluid and electrolyte balance. Sorry, this is the electrolyte word.
Trial version.
So generally, what happens in case of shock? So fluid amount is decreased in case of shock. So in case of severe diarrhea, fluid
Trial
amount inside the
version.
body may decrease. So to maintain a fluid and electrolyte balance, the parental products can be used. The next
Trial
advantage,
version.
parental route is useful for parental nutrition when food cannot be taken by mouth. So TPN, that is called as the total parental nutrition, is given through parental route if a patient
Trial
is not
version.
taking the food through the mouth. Is if patient is unconscious, he or she cannot take the food through the mouth. In such case, that food can
Trial
be
version.
administered through the parental route. So these are the some disadvantages. Sorry, advantages. Now we have to see limitations or disadvantages.
Trial version.
So one of the disadvantage is that a trained personnel is required. Now you can see that parental products are given or administered into the
Trial
patients
version.
only by physicians or trained personnel. Now for taking a tablet, anyone can take a
Trial
tablet.
version.
No skill is required. But in case of in case of use of parental products, a special person will required who is having
Trial version.
training in that particular area. So trained person is required for administration of these dosage form, except parental dosage form. Then second
Trial
disadvantage is that
version.
for formulation of parental product, aseptic procedures are required. Aseptic,
Trial version.
so aseptic conditions are the conditions where there is no contamination of microorganisms. So if you want to formulate a parental
Trial
product,
version.
then if you want to formulate a parental product, then aseptic conditions should be maintained, which in turn will increase the
Trial
cost of
version.
product. Then third one is physiological reversal of drug effect is not possible. Now what is the meaning of this sentence? Physiological reversal. Now what means by
Trial version.
physiological reversal? Suppose a patient takes more than one tablet which will cause toxicity. If such condition is observed, then
Trial
patient may
version.
made to omit the omit that tablet from his or her stomach. But once the parental product is injected inside the body,
Trial version.
it cannot be removed. मराठीत सांगायचं झालं, जर तुमचा एखादा पेशंट आहे झोपेच्या गोळ्या त्यांनी जास्त घेतल्या तर त्याचं वोमिटिंग वगैरे करून त्या झोपेच्या गोळ्या पोटातून काढून टाकता येतील आणि त्या
Trial
गोळ्यांचं जो
version.
ड्रग ते ऍब्झॉर्ब होणार नाही. पण पॅरेंटल प्रोडक्ट तुम्ही एकदा दिला त्याचं ऍब्सॉर्प्शन काय होणार तुमचं कम्प्लीट बायोलेबली दिसणार आहे आणि त्याचं रिव्हर्सल पॉसिबल नाही.
Trial version.
And one of the disadvantages is that this dosage form is costlier than other as manufacturing and packaging require strict aseptic conditions. As I
Trial
told you
version.
that aseptic conditions are required, trained personnel are required for formulation also. Okay, sterilization processes are required,
Trial
extra
version.
processes are required. And because of all these things, the cost of the dosage form increases. So this is one of the
Trial version.
disadvantage of parental product. Then we have two types
Trial version.
of parental products. So depending upon different parameters, parental product can be classified into different
Trial
types.
version.
So first one, uh, parental products can be classified depending upon its use into the following types.
Trial
Look, what are the
version.
following types? So injection is there, infusion is there, powder for injection is there, concentrated solutions for injection is there, and implant is there. So depending upon its use, these products are classified.
Trial version.
So what mean by injection? So injections are sterile solution. Those are prepared by dissolving the active ingredient and any added substances in water for injection or in suitable non-aqueous base
Trial
or in
version.
mixture of both if they are miscible. So injections are simply the solutions which are injected. Injections are
Trial
suspensions,
version.
may show sedimentation but should be readily redispersible on shaking. The suspension should remain stable in order to deliver uniform dose with each
Trial
withdrawal of
version.
from the container. Then infusions. So infusions are sterile aqueous
Trial
solutions
version.
with water as a continuous phase. They are free from pyrogens or bacterial endotoxins and are usually made isotonic with blood and do not contain any added
Trial
antimicrobial
version.
preservative. So infusions are generally large volume parentals. Then powder for injections. Again, powder for injection. So these are the we can call it
Trial
a powder
version.
for reconstitution. So you might have seen a powder for reconstitution. Uh, po- the, these powder for reconstitutions are
Trial
reconstituted
version.
with the help of water for injection at the time of injection only. So if you look at the container of this powder for injection or powder for reconstitution,
Trial
then
version.
you might see two different conditions containers, one containing your active ingredient powder and another containing water
Trial
for
version.
injection or sterile water for injection. And at the time of injection, both are mixed, shaken, and solution is prepared by the physician and then administered into the
Trial
body
version.
cavity. Sorry, systemic circulation. Then concentrated solution for injections. So concentrated solution for injections are sterile in nature and
Trial
administered by the
version.
injection or by intravenous infusion after proper dilution with water for
Trial
injection.
version.
So these are the again concentrated solutions, and before injecting these solutions inside the systemic circulation, they are diluted with your water for injection and then injected inside the body
Trial version.
or systemic circulation. Next is implants. So implants are sterile solid preparations of size and shape suitable for implantation into the tissues to release the active ingredient for a
Trial
long
version.
time period. So implants act as a depot preparation. So implants are solid in nature, which contains your active ingredients, and these implants are placed inside the skin or inside the
Trial version.
muscle with the help of specific surgical procedures. And once these implants are placed inside the body, then these implants
Trial
may release a
version.
drug for longer period of time. For longer period of time. So these are the types of parental products depending upon their use.
Trial
Then
version.
types of parental product depending upon their volume. So you might have heard about this small volume parenterals and large volume parenterals. Small
Trial
volume parentals
version.
also called as ACP and large volume parentals also called as LVP. So small volume parentals, they are used to dispense most of the drugs. So these small volume parentals are generally
Trial version.
packaged inside the ampoules or vials. Small ampoules or small vials. Inside these ampoules or vials, small volume parentals are packaged.
Trial
They are
version.
simple in supplied in single or multi-dose containers. So if ampoule is there, so ampoule is a single dose container. Once you break the ampoule,
Trial version.
so once you break the ampoule, you have to, the physician will inject all the content present in that ampoule inside the patient.
Trial version.
And in case of vials, multiple uh, dosage can be obtained by the physician and injected into patient.
Trial
The volume
version.
is generally less than or equal to 100 ml. Now this is important. Remember this. That is, the volume of small or volume parenteral is less than 100 ml.
Trial version.
In case of large volume parenterals, which are also called as LVP, the volume is generally more than 100 ml, which may uh, increase up to 1 liter or 2 liter
Trial
or up to
version.
5 liter also in case of large volume parenterals. So these are the generally provided for electrolyte and nutrition, for electrolyte replacement and
Trial
nutrition to
version.
the body. These are delivered through the IV route. Again, parenterals can be classified depending upon their route of administration as intravenous,
Trial
intramuscular,
version.
subcutaneous, intradermal, intraarterial, intracardiac, intrathecal, intracisternal, peridual, intraarticulate, and intracerebral. So depending upon where these parental
Trial
products are
version.
administered from the route of administration, these are the different classifications of parenteral product. So intravenous, intramuscular, subcutaneous,
Trial
intradermal,
version.
intraarterial, intracardiac, intrathecal, intracisternal, peridual, intraarticulate, intracerebral. Then based upon type of packaging. So
Trial
parenteral
version.
products based upon type of packaging can also be classified as single dose unit and multi-dose units. So single dose units are ampoules or vials, and
Trial
multi-dose
version.
ampoules, infusions, and pre-filled disposable syringes. So single dose, once these parental products are uh, open,
Trial version.
containers are open, these drugs are administered only once. But in case of multi-dose units, multiple dose can be taken out from the vials.
Trial version.
So you must have seen the vials which are having rubber cork as a stopper, and physician inject the syringe through that rubber cork inside the vial and
Trial
take out the
version.
particular amount of your dosage form. And again, if another patient arrives, physician may take a sample, may take a drug
Trial
from that
version.
particular vial, which means that that vial may contain a multiple dose units. Then pre-formulation study. Now we have seen this chapter pre-formulation study.
Trial
So
version.
pre-formulation study involves testing of your drug candidate, your drug candidate for its stability, for its
Trial
physical
version.
properties, for its chemical properties, so that a stable formulations can be prepared. So that a stable formulation can
Trial
be
version.
prepared. So pre-formulation study involve various types of stages. So we already have seen the pre-formulation study, so we will not go through the pre-formulation study in this chapter.
Trial
So
version.
look, pre-formulation study involves bulk characterization like crystallinity, polymorphism, particle size, hygroscopicity, then pH
Trial
determination,
version.
pKa determination, solubility analysis, partition coefficient. So these are the different
Trial version.
pre-formulation parameters which are carried out before formulation development of any parenteral dosage form.
Trial version.
Then next is the essential requirement for parenteral dosage form. So what
Trial
are the
version.
requirements if you want to prepare a parenteral dosage form? So most important and foremost requirement is stability. So the parental dosage form must be
Trial
stable.
version.
The stability of parental preparation is very important and should be maintained during the storage on physical as well as chemical fronts. So your parental dosage form should be physically as well as chemically stable.
Trial version.
Then sterile. So this is the important parameter of parental dosage form. If product is not sterile, we cannot call it as a parental.
Trial version.
So sterile product, parental product should be sterile. That is, should be free from any kind of viable microorganisms. And in order to prepare a
Trial
sterile
version.
formulation, aseptic conditions are maintained. Then free from pyrogens. So you must have studied the pyrogens. So pyrogens are the metabolic product of uh,
Trial version.
bacteria. So these pyrogens are basically responsible for increasing the body temperature. So
Trial version.
your parental product should be free from pyrogens. Then free from foreign particles. So any kind of foreign particle should not be present inside the
Trial
parental
version.
product. Then isotonic. Already we have seen the importance of isotonicity. If what happens if solution is not isotonic, or solution is hypertonic, or solution is
Trial version.
hypotonic. If solution is hypertonic, then RBCs may burst. If solution is hypotonic, then
Trial
also
version.
RBCs may burst. So hypertonic or hypotonic solutions may cause shrinkage or swelling of RBCs or tissues or cells,
Trial
which may
version.
lead to toxicity or damage to the tissue. So for this purpose, solution should be isotonic with blood or the fluid where that parental
Trial
product is to
version.
be instilled. Then specific gravity. So the parental products meant for intraspinal injection should be have the same specific
Trial
gravity as that
version.
of spinal fluid into which same are to be injected. Then chemical purity. Uh, Parental products should be chemically pure. So this was
Trial
about
version.
today's lecture. So we have seen different introductory part of parental product. We will see
Trial version.
vehicles and additives and other parts in next lecture. Thank you.